When it comes to training legs with lower back degenerative, herniated, and bulging discs, it's important to understand the pros and cons of stability versus instability training because they can both impact your neutral spine position. Remember, neutral spine position is the safe position. It's the ideal position that you want to keep your lower back in where your disc is. That vertebral segment, the vertebra above and below that disc, when it moves out of the ideal position, it's much more likely to injure it. We have covered this topic in previous videos, and as well, it's explained more in depth in any of our programs available at painfreeandfit.com, but neutral spine position has to be customized for the unique person when they're training legs because all of us have our unique tendencies. Some of us have a muscle imbalance that allows us to twist our hips more to one side or another, or that has a leg that likes to externally rotate more than another. This will come out with training. When you're trying to get that last few reps in whatever exercise you're doing, you're going to go into your strength, which is your strength is an asymmetrical strength, whether it's twisting the pelvis or the torso or tilting it sideways or hip hiking or even shifting your hips forward or backward, and you don't have the right amount of muscular contraction to hold it in a neutral spine, you're going to be much more likely to put stresses into that disc and cause injury. So in today's video, we're going to be discussing some of the typical planes of motion that people fall into with training legs that injure the discs. And we're going to talk about suggestions of stable versus unstable exercises to help you get the most out of your legs while protecting your lower back. Now, instability exercises mean that we're going to take balance away from the exercise to create a little instability. The plus of this, such as standing on one leg or using a split squat where we're not as stable as standing on two legs, let's say with a squat or a leg press, is that when we introduce instability, it affords our legs a lot more of an opportunity to use extra muscles. If I'm squatting with my both feet level and next to each other, my legs are going to get a workout, yes, but there's not as much instability and not as much demand on the leg as opposed to when I do a split squat. Now my adductors and abductors are going to contract even stronger because they're balancing me from side to side. I get a better overall leg workout, whether I'm using a split squat, whether I'm standing on one leg doing straight-legged deadlifts, single leg, or if I'm performing a one-legged squat. By increasing instability, it's a great way to decrease the need for extra weight, which especially when you're in acute disc injury, where you're just coming out of a disc injury, extra weight on the back using squats, split squats, lunges, many times is going to irritate the back. So you can still get a great leg workout using this instability system if you stay within 1/4 of an inch of wobbling. You don't want to wobble more than 1/4 inch because the problem with that and the con of instability training is that it forces you more into likelihood of coming out of that neutral spine position and thus injuring yourself. So this beginner's field of training, or this particular chapter in your self-rehab, is great to do without weight and focus on small ranges of motion with the eyes open. If you need to hold on to something for a little stability while training with instability, it's fine at the beginning. Just make sure you have just enough hold so that there is a slight wave in your body. There's a slight challenge to stay stable, but you don't want to wobble more than 1/4 of an inch. Now, as you progress through your rehab with your instability training, we can get into unstable surfaces, which we'll discuss in a moment, but we can also then start introducing some extra resistance, some weights. Now, when you're using weights with an unstable exercise, yes, the danger is that the weight and the resistance can make you throw your form off more. So you have to make sure that you really got your form down in whatever exercise you've chosen with no weight first, and then introduce the weight slowly, perhaps only a few pounds, and adding up very slowly where you can handle a nice and easy 15 to 20 reps. And then you can go heavier. But even with maximum weight as you go through your training, whether you're using one-legged squats with dumbbells, whether you're using split squats with a band around your hip moving up and down, any type of resistance that you want, even let's say holding a barbell here and doing a Zerker style split squat, or holding dumbbells and doing a one-legged squat or Bulgarian split squat where your leg is supported behind you. That extra weight is now going to make your muscles work harder in your legs. They're already working hard for instability, but you're not going to be able to use as much weight as you would typically with a stable exercise like leg press or a normal squat. So the advantage of that is that you're going to get a great leg workout with typically less stress to your disc, but the caution is you have to make sure your form is perfect and you're holding all of your custom neutral spine corrections so that you're not allowing your spine to go into that dangerous range of motion. So let's go through a few of these instability exercises and point out a few examples in different planes of motion with each exercise for you to be mindful of. So let's begin with the concept of flexion, which is bending forward from the lower back. Normally that arch in the lower back loses itself or it flattens out as the torso comes forward, and that's injurious for many people with disc problems. Exercises such as leg presses, where we're laying on our back and our knees are coming towards our chest, have a tendency to move the pelvis in what's called a posterior rotation, meaning that as the knees come to the chest and the pelvis rotates, it flattens the curve of the back from the bottom. That causes flexion or compression on the front of the disc, many times aggravating symptoms. Even in something with a well-trained squat, whether we have a bar on our back or we're holding dumbbells, as we begin to tilt forward, many times at the top when we initiate the motion, or at the very bottom when we're trying to get as much range of motion out of the exercise as possible, we have a tendency to either have the chest tilt slightly forward or the tail to tuck under. Both of those decrease the arch in the back, and that's why those exercises many times cause injury for disc sufferers, not to mention the vertical compression on the disc that exists with both of them. So both of these types of exercises, squatting and leg presses, they're rather stable exercises. You have your both legs symmetrically pinned on either the machine or the floor, and it's easier to maintain that neutral spine position if you learn what it is. How much tail up or tail under you need. That is done through a range of motion or an analysis of your body to figure out how much of that is needed to hold yourself in a neutral position. If you tilt your tail up and you feel some discomfort, you know you've gone too far. If you tilt your tail under and feel some discomfort in your back, you know you've gone too far. So maintaining that middle position between those two extremes, that's a neutral position. It's much easier to hold that neutral position if you're prone to flexion if your leg is behind you, as opposed to choosing squats for your exercise routine. Choosing a one-legged squat where one leg is forward and one leg is behind you. Now, as opposed to having your legs symmetrically placed, the one leg behind you creates hip extension. Hip extension creates a slight anterior pelvic tilt, which avoids that flexion. As you perform one-legged squats, you'll notice immediately that it's much easier to maintain that tail up and avoid the problems of the tailbone tucking under and problems with flexion in your back. Now, when you begin to do this, it's easier to maintain that neutral spine if you're holding on to something as you perform that one-legged squat. Again, keeping the leg further back than you typically do. Many people, when they one-legged squat, they'll bring their leg forward as they do that. However, that's creating flexion. Hip flexion, when the thigh comes forward, creates a posterior rotation of the pelvis that flexes the spine. And if you're prone to injury with flexion, that's going to be a problem. Keeping the leg behind you and emphasizing it, especially the thigh behind you, will help you to maintain that. Once you get good at your mechanics with this, you're going to then want to think about taking your hand away and performing the exercises without support. Now, using a one-legged squat can also be deleterious if you have a problem with hip hiking. Many people have a tendency to have more strength on one side raising a hip up than another. That's due to weak gluteus medius muscles and overactive back and abdominal muscles. Whenever we do an exercise where we're on one leg or one leg forward, the forward leg or the supporting leg is going to be much more likely to hip hike. The hip will shift up and the ribs will want to lean in. So if sideways motions seem to aggravate your lower back disc problems, you want to keep this in mind when choosing one-legged exercises, because as the hip comes down, you'll need to drive that hip downwards, avoiding its tendency to slide upwards as you perform that exercise. Again, holding on to something will help you do this, and you also need to avoid having the rib cage lean in. Now, split squats, where one leg is forward and one leg is back, or lunges, are a great opportunity for you to also use this unstable environment to train legs. When one leg is behind you, there's more of an instability problem from side to side. It decreases the amount of weight that you can typically use, let's say, with a normal squat. If you're doing lunges with a bar on your back or you're holding dumbbells, you'll typically have to use less weight, which the plus of that is there's less vertical compression on the disc. However, with the legs not even, but in a split stance, there's a lot more side-to-side instability. So if you have a problem with side-to-side pain, that may be an exercise you want to avoid, or start off with no additional weight until your form really improves and you're rehabbing or correcting your tendency to hip hike or side lean using either a split squat or a one-legged squat. Now likewise, if you have a problem with rotation in the plane of twisting, where lower back irritation comes out when your pelvis twists to one side or your torso twists to one side, you want to be aware of this on one-legged instability exercises, such as one-legged squats and split squats. Whenever we have one-legged forward or we're standing on that leg as support, the pelvis naturally has a tendency to turn away. So you want to make an effort to turn the pelvis in to keep it in a neutral position, avoiding the tendency for the pubic bone to rotate out. Many times what will happen is as the lower back tries to maintain stability with the forward position of the foot, the lower back will rotate inwards as the pelvis rotates outwards. And you may think that you're straight ahead, but in reality, you're torquing or twisting the lower back because the base of the spine is twisting away while the top of the spine is twisting in. So keep that in mind with any type of split squat, any type of Bulgarian squat where one leg is back and behind you. Again, holding on to something with one or two hands is important when you first start these motions to get the form down, and then after a while you can add weight. Now, an intermediate stage between first learning good form with you only using body weight and using additional weight is to start using a hyper instability system, such as a foam pad, a wobble disc, something that creates more or less of a balance challenge as you're working with these exercises. So let's take the idea of using a one-legged squat. As opposed to standing on the floor, if I stand on a pad, and again, I could hold on just enough tap where I'm wobbling less than 1/4 of an inch, this makes my one-legged squat much more challenging for me. I advance to this after the floor feels nice and stable, and I can make sure that my hips are level, my rib cage is not tilting, there's no twist going on, and I can maintain that proper amount of neutral arch in my back. I can use the same system while I'm lunging or split squatting. And if I have my forward leg on that unstable surface, it makes it much more of a challenge to hold and check my rotation and my lateral flexion or sideways movements. Now, closing the eyes is another option to increase instability. Again, with instability training, remember, it's much more likely to throw yourself off into your neutral spine mistakes. However, the benefit of it is that the more you train in instability, the better your body gets at resisting those abnormal mistakes and holding a neutral spine. So we can use eyes closed training for any unstable exercise. We could use it for a simple split squat or Bulgarian with my leg elevated. We could use it for a one-legged squat. Again, you can tap on and off with your eyes closed, making sure you stay within 1/4 of an inch of instability, not more than that. That could be more likely to injure you. We could also use that in a stiff-legged deadlift, a single leg working exercise where we have our eyes closed, we're tilting forward, coming back up. We could do that with the knee bent at the beginning and then straighten the knee and pivot there. Again, with that exercise, we're trying to keep our ear, our shoulder, our knee, and our ankle all in a vertical line as we perform that. Again, we're thinking about all of our planes of motion that we have trouble in. We've identified where our weaknesses are. If I have a tendency to twist, hip hike, lose my lordosis, I'm focusing on these actions during these multi-planar instability exercises. So I invite you to start plugging in some of these instability exercises into your leg training. It oftentimes will make you realize that your leg training days are not over because of disc injury. You just have to be smart about the exercises you choose and especially how you perform them. If you're having trouble discovering what your custom neutral spine position is, or you're not sure what your unique muscle core imbalances are that cause your lower back to be stressed, check out our fast track program for degenerative disc disease. It applies to degenerative, herniated, and bulging discs at painfreeandfit.com. It will go into a much more in-depth tutorial than I can provide in this video of how to identify your posture movement habits, your muscle asymmetries, and where your core weaknesses are. So you get to training with resistance plus instability, creating a much safer environment for your leg training and avoid lower back disc injury. Feel free to subscribe to our channel if you like what you saw today, Give me a thumbs up to share this valuable information with others. And remember, questions or comments, write in as always. I'll do my best to answer. I hope you've enjoyed this video on instability training for lower back, degenerative, herniated, and bulging discs.